Hello and welcome to Talk to Your Health. I'm your host, Dr. Derek De Silva. It seems like almost every week a new study is released on the benefits of nursing your newborn baby. But women who have trouble breastfeeding or run into problems along the way might miss out on those rewards. My next guest is here to help us figure out some common misconceptions. Sara Chana is an international board-certified lactation consultant, and I thank you for joining me here.
Yes, a pleasure.
It's a pleasure. You know, what I don't understand is breastfeeding has been done for probably a bazillion years.
Yes.
Why are we making a federal case of this?
Because every woman and every baby has a desire to breastfeed, but not everybody knows how to breastfeed. Women have different shaped breasts. Some are large, some are small. Some of babies' mouths are small, some of babies' mouths are larger. And to coordinate that and get that dynamics going is a little bit challenging.
But not knowing how to breastfeed is like saying, you know, not knowing how to walk for me or breathe. It just seems so natural.
Well, it's interesting because when a child does start to learn to use a fork and a knife, you definitely prompt them. You tell them you hold the fork like this, use the knife like this. There is teaching. Even when it comes to walking, you balance your child and teach them how to walk. When it comes to breastfeeding, what most people don't understand is that babies breastfeed between the hard and soft palate. They breastfeed in their throat, not in the front of their mouth. So if a baby latches on to the tip, the woman's going to be in excruciating pain, and if she starts tensing her body, the little baby's going to look up at her and say, what am I doing wrong?
Right, right.
So women have to teach babies to stimulate between their hard and soft palate and their throat.
So how do they do that? What do they do?
Well, I like to use a technique called RAM, which is rapid arm movement, and I know there's this whole movement of biological nursing where babies are just going to get it, moms are just going to get it, but I find that women come to me as a practitioner ready to quit breastfeeding because of the pain.
So show me, what do we need to do?
I like them to take the breast and make it very, very pointy because, again, they're throat feeding, not mouth feeding. If a person bites with their jaws, it's going to hurt. So what you want to do is you want to bring the baby to you. It's called rapid arm movement. You actually bring the baby far and ram the baby on. Women are a little
Really?
intimidated at first.
I mean, you don't want to smush the kid.
No, absolutely not. But what happens is if they stop with the front of their mouth, they clinch, and that's very painful. Once a baby is stimulated between the hard and soft palate, they won't go back to stimulating the front of their mouth. It's just something they need to experience.
And is it a learned behavior from these children?
Yes.
Okay.
There are some women that will have a perfect experience with breastfeeding, but 80% of the women are all, you know, like hiding in the background going, oh, I was in so much pain. Once a baby's stimulated, if a baby's keeps on clamping on the tip of the woman, what she needs to do is put her finger into the baby's mouth so that she can stimulate with her finger between the hard and soft palate so the baby feels where the baby needs to go. I can tell you that once babies learn this behavior, they don't go back to nursing in a painful way.
Pain. One of the issues that women, as you started talking about, is pain and the do's and don'ts and infection. Mastitis is a real issue. Can you comment on that?
Sure. So mastitis, in my observation,
and then some of the symptoms of mastitis, which we're going to, talk about. Right.
So mastitis, in my experience, is due to mismanagement of breastfeeding. It's not a part that you should experience. You have to experience with breastfeeding. It's mismanagement. When the woman's overstimulated, she's going to get redness, tenderness. She's going to get a fever because it's called a milk fever, where the body is trying to reduce the inflammation. I know that breast infections are really inflammation. So what I do is we always use ice. This is an ice pack as opposed to heat. Heat was the protocol for many, many years, but if you twist your ankle, what do you put on it?
You put ice on it, absolutely. Sure.
So when women have red swollen tissue and you put an ice pack on it, the breast then releases the inflammatory response, and then the milk can drain and women are not in pain.
Engorgement.
Engorgement. Well, there's two things I use. One is cabbage and one is a grated potato. So I like to grate a potato, take out the grated potato, put it in either a gauze pad or a muslin bag, or you can use an old knee-high. Works beautifully. It works great. And you put it up against the breast, and it reduces inflammation. Potatoes have an incredible ability to reduce inflammation.
Topically.
Eating it.
And what's the other thing that you said?
Green cabbage.
Green cabbage.
You take the cabbage leaf, you crunch it in your hand, and you put it up against the inflamed tissue.
Wow.
It's what they used to do for years. When you had any kind of inflammation, they would take the cabbage leaf and crunch it, and it works beautifully.
That's the type of stuff that I like to hear. You know that.
Yes.
And I thank you very much for joining us.
Thank you so much,
Great
Doctor.
information.